One obvious area of potential shoulder pain is going to be your glenohumeral joint. So it's actually the shoulder joint. It's the ball and the socket, right? So the ball, where the ball sits into that fossa, the glenoid fossa here. So if that is inflamed, if that is arthritic, obviously that can cause a lot of shoulder pain. This is going to be that deep, boring pain. It may even be painful at night when you just sleep and you just can't even, you can't lay on it or whatever. It's just aches all the time. It's just real achy. Can be pretty painful, can reduce ranges of motion, can make it very difficult depending upon the severity of the arthritis, can make it very difficult to even move, or you don't want to move it, etc. So some things that you can do, or some things that you may see on x-ray. So what you may see sometimes is that the ball in the socket here, the ball will be shifted up into that fossa. So that you have your socket and you'll see that ball is shifted up. So if that's the case, a lot of times if you can strengthen your rotator cuff muscles to help to pull that shoulder back into its proper location, so your deltoid's not stronger than some of your auxiliary rotator cuff muscles, it can help to get that socket in the right spot, or get that ball in the right spot in the socket, so that way it goes and moves in the correct orientation and actually does what it's supposed to do. Then therefore, what you'll end up having is less pain, less wear and tear. Hopefully it'll help at least stop the arthritic process from getting worse by getting that ball back where it needs to be, by strengthening some of those external rotators, by strengthening the subscapularis and the different muscles in between the shoulder blade and the rib cage. So those are some options that you can do to help to strengthen and help to get that placement back in that GH joint. If it is achy and you do have arthritis in there and you are just having a hard time getting in front of it, some things that you can and should look into are things like platelet-rich plasma therapy. Also too, if it's very, very severely damaged and you don't want to go steroids. Again, I'm not a huge fan of steroids because they will progress and promote arthritic change, even if it does help with some of the arthritis. So we want to get in there with good things that help inflammation. So things like PRP, amniotic fluid, possibly even Wharton's jelly that contains some mesenchymal stem cell, perhaps something like that to get into that joint to help reduce that inflammation, stimulate the healing process, and then to keep that going. And so that's where shoulder rehab is so important, making sure that you have someone that understands the biomechanics of that GH joint, getting that ball back down into that correct area, getting it down and back where it needs to be so it tracks right, and then getting ahead of that inflammation with one of the biologics that I mentioned. But that can be a true solution to actually helping you not only with your pain, but to prevent it from getting worse and hopefully prevent it from coming back.